Hello, ladies and gentlemen. Welcome to healthlife360.com. We deal with Medicare, Medicare Advantage plans, Medicare supplemental plans, Medicare prescription plans, and much more. Here are our contact informations. I am Dr. NIK NIKAM. I've been a cardiologist for 40 years and I'm continuing with the service to the Medicare population through the Medicare health insurance programs. In this presentation, we are going to focus upon an important topic, and that is what you should know before you switch from a Medicare Advantage plan to a traditional Medicare and supplemental Medicare insurance or the Medicap insurance. There are very important steps that need to be taken into consideration because you don't want to lose your existing coverage through the Medicare Advantage plan. As you know, basically we have the traditional Medicare, which involves Medicare Part A, Part B, and Part D, which is a prescription plan, and Medigap or the Medicare supplemental program. If you have been enrolled in a Medicare Advantage plan, which is Plan C, with a built-in prescription plan, and you're not happy with the program and you want to switch over to traditional Medicare with the Medicare supplemental insurance to cover the co-pays and deductibles for these various components of Medicare, then you will be interested to know some important aspects which have to be done so that you do not lose your existing Medicare Part C coverage. Of course, no matter whether you're in a traditional Medicare program or a Medicare Advantage plan, you still need to continue your Medicare Part B payments, and the payments for 2022 will be $171 per month. That is an important thing that you have to keep in mind so you don't stop Part B payments. And Part B payments may also be tied to your income, and if you are a high income earner, then your premium will be obviously much higher. You want to consider changing over during an enrollment period, that is the annual enrollment period or AEP, during which you sit down with your insurance agent and look at all the pros and cons of continuing with the Medicare Advantage plan versus switching over to traditional Medicare with a Medicare supplemental plan. When you switch over to a traditional Medicare supplemental plan, understand that you also need to have a Medicare prescription plan in place. Otherwise, if you want to start a prescription plan later on, you may end up paying penalty for the duration of the period that you did not have the prescription plan. Why do people want to go from a Medicare Advantage plan to a traditional Medicare? There are many reasons. Maybe they are not happy with the Medicare Advantage plan they have. Maybe they don't like the restrictions and authorizations and many limitations put by the Medicare Advantage HMO or PPO plans. Maybe some of the drugs are not covered under the existing prescription plan and you don't want to deal with the hassle, so you want to switch over to a standalone Medicare supplemental program. Or you move to a new location and maybe you don't have the good coverage that you had, so you feel that you're better off with a Medicare supplemental plan and a separate prescription plan or a standalone prescription plan. But let's keep in mind certain things that will happen when you switch over from a Medicare Advantage plan to the traditional Medicare program. Of course, some of the benefits that you are getting, like dental, vision, or hearing, you're going to lose those benefits. Or if you're getting a gym membership, or you are getting a transportation, things like that, they may not be covered under the traditional Medicare program with a Medicare supplemental program. So remember that when you have a standalone prescription plan or a Medicare supplemental plan, the premiums keep going up each year, and of course some of that may be tied to your high income level. And as I said, you need to start a new standalone prescription program when you move over to a traditional Medicare with the supplemental program. You need to make sure that your drugs are covered. Beware that certain conditions may prevent you from getting the Medicare supplemental program. Conditions like congestive heart failure, chronic obstructive pulmonary disease, or like Lou Gehrig's disease. Many conditions can prevent you from getting the supplemental program. So that brings us to the topic of why is it important to start off by applying for the Medicare supplemental program at the beginning of this annual election period. Because whenever you switch over from a Medicare Advantage plan to a Medicare supplemental program, there is going to be a history questionnaire which you have to complete. There is going to be an underwriting process where they review your medical history through the Medical Information Bureau, and they review your medication. There may be a chance that they may not approve your application. First thing you want to make sure that the first step is to apply for the Medicare supplemental program. And once you are approved for the Medicare supplemental program, then you apply for a standalone prescription plan. That is step number 2. Do not apply for a standalone prescription plan while you're on Medicare Advantage plan, because if you apply for a prescription plan, standalone prescription plan, your Medicare Advantage plan will be automatically discontinued. You don't want that until you are certain that your Medicare supplemental program has been fully approved. Once your Medicare supplemental program has been approved, then you apply for the standalone prescription plan. Once the prescription plan is approved on the first of the month in January, the Medicare Advantage plan will be automatically discontinued. Ladies and gentlemen, this is a very quick overview which is of vital importance when you are switching over from a Medicare Advantage plan to a Medicare supplemental program. That is, you make sure your Medicare supplemental program is approved, because there is going to be a new underwriting, which means you have to complete a history form, and they're going to look at your medical information through the Medical Information Bureau, and if there are any red flags, they may not approve your supplemental program. If they don't, then you're better off staying with your Medicare Advantage plan. We can help you navigate through these various steps so you don't get stranded without adequate insurance coverage. Please contact us and we will be happy to serve you and guide you in the right direction. I am Dr. NIK NIKAM. We have many videos on the topic of Medicare Part A, B, D, C, Medicare supplemental program, and Advantage plan programs. Please do watch them. We also have a video on Medicare Update 2022. I will see you in the next video.